All right, environmental emergencies, we break this up into heat and cold, as well as elevation, and then as we submerge below atmospheric pressure. But as we lose heat, we also gain heat through these certain ways, and it shows you as we lay down on something, we can actually draw heat into the object that we're laying on, or if the object that we're laying on is hot, it can take heat and we'll draw it in. So conduction, as we sweat and the air around us cools us off, there's evaporation. If we decrease evaporation by putting on an extra layer over us, then we keep that in. Respirations, this is just loss of normal heat as we humidify and heat up air. There's convection if there's blowing air conditioning on us, or a wind that's being blown on us, or if we were in a sauna. This is all ways of convection. We either lose heat or gain heat. And the last one is more radiation, where we're either getting this from the sun or we are radiating heat off of our skin. So think about these ways of either retaining or losing heat as we go through this environmental chapter. Wind chill has an effect, as well as the humidity levels. All of these have areas and significance when we talk about our environmental emergencies, either heat or cold casualty. As we look at the symptoms here with our thermometer, we can see that as a person now is losing heat, as the temperature drops to 95, then to 90, and then below 90, we start to see that they went from a more cold, they're awake and conscious, then they become sympathetic, so the heart rate goes up, their respiratory rate goes up, they get much more colder, their body started to lose that shivering effect, they start to move even further under 90, and we're looking at now severe hypothermia continuing to trend downwards, where the heart starts to slow down, their breathing becomes a lot less efficient, and down to where the heart actually is beating so slow that they may seem to be in cardiac arrest. Their pupils are dilated, they're not responding to us anymore, and then eventually where everything just shuts down and metabolism has stopped. In these cases, we tend to take a slightly more aggressive stance in really managing our hyperthermic patients that are in cardiac arrest. We'll tend to warm them up before we decide to say there's nothing more that we can do. However, if we just look at this, we want to be able to identify at what point our patients are presenting. So how are they acting? Are they awake and conscious and their heart rate and breathing rates fast and they're still shivering? Have they lost their shivering? Are they slowing down and becoming more confused? Is the heart rate and breathing slowing down? Are they now obtunded, comatose, and we know that the heart rate is barely palpable? What do we need to do? We need to warm these people up. In the earlier stages, just removing them might be useful. At the later stages, we're going to have to do some active rewarming. This means actively putting in hot water, immersing them, and getting them warmed up. We'd like to start from the core and work out to the extremities. So we don't want the extremities to warm up and then send a chill of ice cold blood back into their heart. Again, we don't want to rewarm them from the extremities when they get into this more severe and extreme hypothermia. Because if we warm up the extremities, we're just sending this warm blood, and that'll cause this kind of ice chilled slushy stuff back to the heart, causing the heart to go in sudden cardiac arrest. So we try to warm from the core and back out. So this is where we look usually. Now we might think that this environment for extreme weather has to have snow for people to become hypothermic. This may not be the case. This may be that they're overexposed to ice cold chilled weather, and the wind chill is really high, as we saw in the previous slide. And this may even happen at parts of Mauna Kea, Haleakala on Maui. Just these colder areas with wind chill. We can even see this happening if people are out in the ocean between the Molokai channels, that they've been submerged in these waters for a while and just swimming, and their body is just losing a lot of that internal heat, and they're becoming more and more hypothermic. Now, in more industrial areas, there are cases where people have been locked into like their these kind of walk-in fridges and refrigerated mats or storage-like containers, because the temperature is so low that they can be exposed to this for quite some time, and we might find a hypothermic patient there. Keep in mind that some of our patients may already be more prone to becoming a environmental exposure either to heat or cold, as they may be intoxicated, which keeps them from moving around, and lack of clothing, as in this individual is not really wrapped up. On the same token, if it was hot for this individual and it was a heated environment, he could also become a heat casualty, as he's not replenishing the fluid and liquid that's important to maintain his hydration and circulatory status. He may also be on medications that cause the temperature to be elevated, or even to cause the metabolism and heart rate to be slower. And this can cause people to become either heat or cold casualties. So don't just assume that because they are confused and disoriented, and it's obvious that there are products for consumption and ETOH or alcohol, that we also want to check their core temperature or their temperature to make sure that it's not an environmental cause that's causing them to be disoriented. Elderly people or our late adulthood generation, they may be on, like I said, medications that keep them from keeping their body warm and keeping circulation going. So they may be on antihypertensive or blood pressure medications that cause the internal body temperature to either be lower than it should be, and they don't have a lot of muscles and activity that keep them to shiver so that they can maintain their body temperature. And sometimes their thermoregulatory system is not necessarily as robust and functioning as well. Here's your stages in Celsius and Fahrenheit. Again, that 95 is that big cutoff there you see, and then it gets down into the 85s, and then further on down. Try to look at this slide and go back and think, all right, so we got some shivering, and we got some tachycardia, tachypnea. We got less shivering, then we got less tachycardia, hypoventilation, obtunded, and then maybe they're now in cardiac arrest, no pulse actually felt, no air being moved. And then the color of the skin, we're going from a waxy color to where now they're cyanotic. This is just giving a slide of whether or not this cold water immersion, which can cause hypothermia, how long and limit to this exposure and their safety, and whether or not they would survive in this type of exposure. Now, frostbitten, frost nip, these are where the injury is to an extremity. Then this is where maybe blood flow is reduced, and we've exposed those extremities and body parts. Can happen to the nose, the ears, the feet, and the fingers. And that's because we've just allowed them not to keep dry and well insulated and kept away from the cold. And so we end up seeing some of the early stages where it's waxy and cold and numb, to where it becomes more of the circulation is now just so poor that the cells have now started to break apart, and as they lyse, they release their contents, and this contents is very toxic to the tissue, and we end up seeing that the tissue now turns blue, and this stuff, as we then were to rewarm them, would end up losing that blood supply to that area, and it basically would have to have them amputate these parts off. Here you can see the discoloration. Not sure whether or not the treatment that we would prescribe would help. This blood flow would have to be looked at days to months later, and to find out whether we have adequate blood flow to those tissues. This person might end up having this part of his foot amputated, as all those blood vessels have been damaged, as well as the cells to those tissues and bones. They've just kind of separated, opened up, and lysed, and now, you know, there's no healthy tissue there to restart the circulation. Here we see severe outcome where it's extremely discolored and not flesh color anymore. Here's another slide then to give you an idea, and just got to remember the numbers, as these are the testing numbers for you, and then put this to the categories of those symptoms.